When we're dealing with healthcare technology, sometimes we can get so wrapped up in what technology does that we forget how we actually use it. And here to talk with us today about their workflows is Community Health Centers. We have Kim Barkman, who is the Director of Informatics. Did I get the title right?
Information Services.
Information Services.
It does include informatics as well as information technology piece.
Oh, I got
so
partial
we've
credit
kind
on
of
that one.
aligned and blended both of those important pieces within the organization.
So, Kim, give me a little bit of a background on what we're talking about here. Why this importance of workflows here?
Yeah, I think that it's all about really understanding that when you are implementing technology and when you want to leverage that technology, you really have to think about three different components. You have to think about the people part of that, the process part of that, and the technology part of that. And really, all of that needs to come together to have successful outcomes. And I think oftentimes we're so focused on implementing the technology and making sure that that all goes well, that sometimes we don't focus as much on the impact that that has on the users out there using the technology. And as we all know, in a organization like ours, Community Health, the electronic health record really drives the workflow out there at the sites. So they are a very important part of getting the most out of that technology, but also making sure that they're comfortable and that they have a voice in how that technology is used and how their workflow is going on a daily basis.
So how did we get to the point where we started working on the workflows? I mean, how did you identify that as a part to work on?
Yeah, well, I credit the organization for that. Actually, back around 2011, this organization decided to invest in informatics, which for a community health center organization, it's quite unusual. But I think they recognized that skill set would be very important as we began to innovate more and bring on more tools. Of course, eClinicalWorks had all sorts of things that we wanted to install and utilize. But they recognized there was a number of things occurring. First of all, our electronic health record, it was becoming very apparent that it was more and more critical. The documentation and the navigation was becoming a key factor in many of our regulatory requirements because as a federally qualified health center, we are required to report on things like HEDIS, UDS, we are patient-centered medical home certified, and also we were moving from stage 1 meaningful use to stage 2, which is ultimately more complex. And they recognized that that was becoming more and more of a focus of the organization. Also, they wanted to make sure that somebody was advocating for those users and had the skill set to do that. And then just as importantly, they wanted to make sure that there was a group of people who were going to manage and support the electronic health record moving forward. So we had installed it, and now what comes next?
Speaking of those people who are helping to manage, we have some other members of your team here.
Yes, we do.
Would you introduce everybody for us?
Sure. Very important members of the team, actually. This is Yadira Solano, and she is our manager of informatics. So she is very key, obviously from a nursing background, and she has many, many years at the bedside, has been with CHC for almost 8 years now. And Yadira is very instrumental in the work out in the field because you can't do everything from the corporate office. You really have to have your eyes and ears out there really monitoring and understanding how the users are interacting with the technology. And then we have Lauri Rose, also very important to the team. Her focus, while Yadira's is on the clinical side, Lauri's focus is on the practice management, the front end of the office workflow. And so Lauri has been key in a lot of our documentation pieces, understanding the whole life cycle of scheduling all the way to billing. And so both Lauri and Yadira, the reason that we're at the point we are now with our workflow platform. So Lauri, I believe, has been here going on 17 years.
Be 17 years in December.
With community health centers. So I'm very fortunate when we did establish the informatics team that we were able to get Yadira and Lauri as resources because they do have so much knowledge about the workflow within the organization. So we're very happy to have them. And besides a analyst and the three of us, that is our informatics team. So we count very much on each other to move things forward, and we're very excited to share, our work. We do whenever we have the opportunity, and we're very proud of, what we've been able to put in place for our users.
Well, let's get right into some of those details there. I'm eager to hear about it. I'm sure our audience is too. So what are some of when you did this workflow analysis, what are some of the things that you identified as being issues?
Yeah, I think speaking for all of us, one of the key things that we knew was happening out there is we had 11 different facilities that were operating fairly independently. They had some unique functions depending on the services that they were providing. And we found that standardization across the board was not there. In many cases, there was no consensus on the best way to input something into the electronic health record. As everybody knows, electronic health records can be a little flexible, and that creates some challenges with making sure that people know the most optimal pathways. So that we knew we had to focus on. Also, there was not a whole lot of support in place for the users out there.
Are we talking internal support or support from eClinicalWorks?
No, not support from our vendor, mostly support for issues that they were having at the point of care or questions they had about how to best input something that a provider had asked for, and maybe mostly real-time support. It wasn't, support. We do have a help desk, area where users can call in if they do need assistance, but we wanted to focus more on real-time help because they need it when they need it, and it's important to give them the tools to, to provide that.
Right, who has time to take all that time out of their data to
exactly
find out what that answer is.
And, we know how the clinical workflow goes, or the care team workflow. I mean, you have a problem and within the next 10 minutes, you're off to, 2 more patient care interactions. So the real-time support was really what we wanted to focus on. Communication channels were not the best, and we knew that we needed to put more controls in place and have better documentation. So we knew there was quite a bit that we wanted to work on.
So what did we do to work on that? Or what did you do to work on that? How do you start tackling those issues?
Yeah, we had to really put our heads together and do a lot of brainstorming about that. But ultimately what we decided to do was we came up with the concept of a super user network because we knew we had a fairly small team. It was challenging for all of us to be out in the field full time and cover, what now we have 13 facilities. Then at the beginning we had 11. And so we went through the process of speaking with the executive team and determining how to best do that. And so I put the concept in front of them about a super user network. And ultimately, everyone thought it was a great way to get that support together and representation from all the different facilities. So it ended up being ourselves plus 22 people out there in the field, and it really represented about 8 different distinct focuses. So we had representation from scheduling, clinical, practice management, billing, lab, x-ray, medical records, and we also deliver medical and dental services. So we wanted to make sure that each area had a voice, and then from there we worked to get the platform set up. And then the next step in all of that, which was pretty critical, is we put together actual training for those super users because we couldn't expect them to have the skill set we needed for them to be successful. We wanted to set the expectations for them, make sure they understood their roles and responsibilities. And so we committed to, the organization committed, which I applaud this organization for doing. But over the course of 8 weeks, we actually brought in different departments, and we taught them everything from, what a process is, the definition of a process, how to process flow, so that we all together could determine what those core workflows were across the organization, and then kind of go from there.
And the training part, I know that, I'm sure there's a lot of organizations out there that understand there are things that need to change. They can probably get somebody out there to, in their organization to research that and figure that out. But then, the question becomes spreading that out to everybody else. And I think you started to address that there. Is there ongoing training? What happens after that initial phase where we spread the information to all of the organization? And then how do we make sure they're still maintaining that level of...
Well, that's key, Adam, and that's an excellent question. And really what our big goal was from the beginning is to have the tools for them so that they could understand exactly, what those processes need to be. So what we did is we actually created a master catalog of workflows. And
is that what we've got here?
That's what we've got here. So over the course of the super user network and 5 months of work, we had individual work groups where each of those areas worked on their specific workflows. We were able to put together a master catalog of workflows, which is now really our body of knowledge.
Let's show everybody this binder.
So actually, we can have Lauri take us through it, because she has really been the one to kind of put this together.
Well, what we did is we identified workflows that were specific to a specific job role, knowing that some of the job roles are going to blend into different areas. So we have workflows in general navigation, which are areas that all users could benefit from, such as simple as how do you log into eCW, what do you do when you walk away from your system. Then we have our clinical workflows, which is basically for our clinical support team members and our providers. Then we merge into our practice management, which are going to be for our front end users. Those are our front desk team members, our PSRs and our front desk specialists. And then we go into our medical records. So this is all going to be about scanning, how we manage our fax in and out box, how we scan documents. Then we have ones that are specific to the providers. We have workflows that are specific to referrals, and then we get into our scheduling. So things that are specific to people that are going to be scheduling an appointment. What are the basics? How do you schedule a pediatric, an OB, a behavioral appointment? We have things that are specific to our lab. So their workflows, how they get through their daily job. Again, for X-ray, what do they need to do? Dental, we've created some of our dental workflows. We have some that we are in the process of for management, and then we've also created a listing of workflows by role. So a new team member coming in, when they come in for their core training, are going to get a listing of the workflows that they need to be able to utilize and understand for their daily process. So it could be some from general navigation, could be some from lab, from scheduling, from practice management. So it's across the board, so that way then it's customized to their specific role.
We made it fairly modular, so we can have the standardization there, but it can be specific to, like Lauri mentioned, the role that someone's coming in with. And then key to having it be available is we actually created a learning portal out on the desktop. So anytime a user has a question about how to do a process that maybe they do not do very frequently, We have all of our workflows, our best practice, for how to do that process available, just a click away on everyone's desktop.
And it's helpful too when we're out in the field, because I go out as well. And when we're out there and they're having a problem, we can take them right to the desktop. We can take them to that specific workflow and they can see it right there. So it's helping to bridge them to utilize the information that's out there available to them, because it's only a couple of clicks away.
Does the super user network, do they answer the questions right away, or do they direct them to this documentation on the portal, or how does that work? You don't want to hold everybody's hand indefinitely, right? I mean,
True, and they are our front line. They are our frontline support. So Yadira can talk about a little bit about the release notes.
Yes, we have a process of managing change. Now, we want to control the change. So we have a two process. We have a committee, which is a change control committee. So when Lauri and I go out to the field, we get feedback from the super users as well as the end users. So it could be a provider, it could be a front desk person, a dental person. And then from there, we bring that information back. Many times we do direct them to complete what we call a change control form, because sometimes they want to change and to them it seems really simple, but when they actually put it on paper, they're like, oh, we need this and that and the other. So it becomes complicated. So we ask them to kind of write it out and diagram it for us, so that way we have a better approach at making that change. From there, it's brought to our change control committee, which at this time has about 10 to 12 persons, directors, managers, ourselves, the informatics team, and then we hash it out. We discuss the change. We want to make sure that that everyone is aware of the change, because there's different levels from executive to the end user that change do make effect. So we try to make sure that we hash that out, and then we bring it back, and then we have it in a controlled environment, so we test it. We sometimes pilot them in different centers. Sometimes we just put it out there for the super users on a monthly release note, and we do have a monthly webinar. We send an invitation, we get on the call, we show them all the changes, the enhancement, any fixes that we have out there. Is a great opportunity for the super users to ask questions, to see what this change, how it's going to affect them, to start to plan out how they're going to share this information, because they also have lots of different levels, from the director to the end user, providers, the different specialties. So it does take a lot of planning. So those two venues are the venues that we use, and Lauri and I, when we do go out to the field, we get a lot of feedback, mostly positive, on how we are assisting them with their changes. So all that, then once we get it out there to our users, then we go and we update workflows, because we have to reflect it all on workflows. And then when we go monthly to update, to kind of support our users, we can refer back to release notes, to the workflow. So we have lots of material on hand, easy to click to, on paper, on webinars. So we try to have different venues for our end users to use in order to keep themselves updated, because that was one of the main complaints. How we never get communicated. We didn't know this change happened. We didn't know that change happened, and we use different venues to get them that knowledge.
Well, all the things that I've been hearing so far, from assessing the current state of the situation, to identifying what we can do about it, to then actually codifying and writing those processes and changes down, and getting feedback from users and things like that. This sounds exactly like the PCMH program. It sounds like the PCMH program executed to the highest level. So it sounds like you've done a fantastic job, and organizations of all sizes, I'm sure, can put this into place, large or small. It sounds like you have an internal team with the resources to do this type of analysis, and of course for the practices, our clients that are smaller, eClinicalWorks has PCMH consulting services, optimization services that you can sign up for so that we can help you do the same types of things that have been done here. Now, before we go, let's talk a little bit about what you got out of this. So we've talked a lot about, what were the problems in the beginning, what we did to change those things. What effect did it have in the end?
Wow. Well, standardization, I think our users in general are so much more confident with the system. I think initially we saw some hesitation in, doing some of the more complex functions that were available. And I think, just having that standardization has given the user that confidence. And also the users having a voice.
Yes.
Huge when it comes to the adoption and buy-in. Because let's face it, healthcare moves very rapidly, and like Yadira mentioned, there's a lot of change. We try to help set the expectation so that we can help them manage the change. Otherwise, it's just, one new thing on top of the other. So I think helping to manage that change along with them and that buy-in and adoption has really helped us move things forward a lot quicker. We've been able to innovate with, different initiatives across the organization because we all now know how the whole process goes. They know exactly what they need to do if they have something they want us to take a look at. I think risk mitigation, efficiency, but most importantly, to your point, Adam, I think the patient piece of that is huge. Because when they come into an organization and they see that things are standardized, that the staff is knowledgeable, and that they're confident, they're much more likely to return to us as their patient-centered medical home because that gives them confidence in us. So I think there's been a tremendous amount of gain, and we continue to gain.
I think too the big part of this is the fact that it's not just us sitting outside of a center creating these workflows. We create the workflows and then they're vetted out. The directors and coordinators are taking them to the front end user and saying, please use this, tell us what's wrong with it, break it. And that way then it comes back. So there may be multiple revisions to a workflow, but ultimately that's how we get to best practice. By having them be involved with it, then they have a bigger stake at doing it the way that we need for it to get done so that we can extract the information out for all of these reports and agencies that we have to report to. So
I can't help but draw parallels between the way that patient-centered medical home asks you to treat your patients with getting feedback from the patients on what do you want your care to look like, what care options work best for you, and the way you're treating your users and saying what workflows work best for you. Tell us what you need to be successful.
Right.
So it sounds like this really is
we're all in this
change.
together,
Exactly.
right? Ourselves and the users. So we think that's very important to recognize.
Yes.
Yeah, user satisfaction with their role and their ability to be successful in it. So we're all in.
Well, Kim, Yadira, Lauri, thank you so much for all of your insights today. It's been great having you. Check out some of our other eClinicalWorks podcasts coming up.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.